welcome to the Deep Dive. Today we're diving into CDKL5 Deficiency Disorder, CDD for short. It's a rare genetic disorder, and we're looking at some really interesting new research on adults with CDD. This research is really important because it gives doctors a lot more insight into the disorder and how to treat it.
Yeah, you're absolutely right. The more we learn about the natural history of a disorder, its typical course, and how it progresses over time, the better clinicians can really anticipate challenges and then tailor treatments
Yeah.
and ultimately improve the quality of life for their patients.
Okay, I think I get it. Can we maybe back up just for a second? I'm still a little fuzzy on what exactly CDD is.
Of course. So CDD is caused by a change in this CDKL5 gene, what we call a pathogenic variant.
Okay, a gene. So the things that determine our hair color and eye color and stuff.
Exactly. But this gene is responsible for making a protein that's super important for brain development. And if the gene is altered, the protein isn't made correctly. And that has a big impact on how the brain develops and functions.
So this one gene can cause a whole bunch of problems.
It can. And in the case of CDD, those problems typically involve seizures, intellectual disability, and developmental delays.
That sounds really tough. So what are we going to be learning about today specifically, as we dig into this research paper?
Well, first, we're going to get a good grasp on the basics of CDD. You know what causes it, how common it is, the key challenges it presents. Then we'll look at some of the specific findings from this research on adults with CDD, like how epilepsy evolves throughout their lives, the possibility of them losing skills they've already learned, and even a possible link to movement disorders that resemble Parkinson's disease.
Whoa, okay. Lot to unpack there. I'm ready if you are. Let's start with the basics then, I guess. You mentioned the CDKL5 gene and a protein. Can we walk through that again? I'm not a big science person.
Absolutely. So think of the CDKL5 gene like a blueprint, and the protein it codes for is the builder. And this builder is responsible for making sure the brain develops correctly. But if the blueprint has a mistake, the builder can't do its job properly, and that's where the problems start.
Okay, that makes a lot more sense. So how common is this blueprint mistake?
Well, CDD is considered a rare disorder. It affects about 2.36 out of every 100,000 births.
Wow, that is rare. And I know you said we'll get into this more, but what are some of the most common challenges that kids with CDD face?
So almost everyone with CDD has epilepsy, which means they experience seizures. And these seizures can be really difficult to control with medication. And then on top of that, intellectual disability is also a hallmark of CDD, meaning people with CDD have difficulty learning and processing information.
That must be so hard for both the kids and their families. So this research we're talking about focuses on adults with CDD. Why is that so important? Don't we already know a lot about CDD from studying kids?
That's a great question. You see, most of the research on CDD has focused on children because the symptoms are often most apparent in early childhood. But this new study gives us valuable insights into how CDD affects people as they grow older, which helps doctors better understand the long-term needs of individuals with this condition.
So it's like we're filling in the missing pieces of the puzzle.
Exactly. By studying adults with CDD, we can gain a more complete understanding of the disorder's progression across the lifespan.
Okay, so let's talk about epilepsy a little bit. You mentioned that almost everyone with CDD experiences seizures. What can you tell me about the types of seizures that are common in CDD?
Well, imagine kind of a spectrum of seizures, ranging from very subtle to very dramatic. On one end, we have infantile spasms. These are brief muscle contractions that can be so subtle they're often missed. Then there are tonic seizures where the body stiffens.
Okay, I'm starting to see the spectrum here.
Right. And as kids with CDD get older, they might start having myoclonic seizures, which are sudden jerks or twitches, or they could experience the more well-known tonic-clonic seizures, also called grand mal seizures, which involve convulsions and loss of consciousness. And then even later in life, we might see something called atypical absences, which are non-motor seizures that might look like daydreaming.
Wow, that's a lot of different types of seizures. Is there anything that makes seizures in CDD especially difficult to manage?
Unfortunately, yes. Seizures in CDD are often what we call drug resistant, meaning they don't respond well to the usual epilepsy medications. This makes it extremely challenging to achieve seizure freedom for these individuals.
That's got to be incredibly frustrating for everyone involved. But I'm curious, does anything change about these seizures as people with CDD get older?
Interestingly, this new research found that for many adults with CDD, their seizures actually improve over time. While they might not disappear completely, they often become less frequent and less severe.
Well, that is a little bit of good news. But I guess it also makes things more complicated for doctors. right?
Hmm.
They can't just assume that what works for a young child with CDD will also work for an adult with CDD.
You're absolutely right. This unpredictable nature of seizures underscores the importance of understanding the full course of CDD, and it highlights the need for individualized treatment approaches that adapt to the changing needs of each person.
That makes a lot of sense. So we've talked about epilepsy. You also mentioned intellectual disability as a major challenge. Can you tell me more about how CDD affects learning and development?
Of course, intellectual disability in CDD can range from severe to profound. This means that individuals with CDD will have varying degrees of difficulty with learning communication and daily living skills.
And does that mean that most people with CDD don't develop speech?
Sadly, yes. A large majority of individuals with CDD do not acquire speech. However, there are assistive communication devices and strategies that can help them express themselves and interact with the world around them.
It's amazing how technology can help bridge those gaps.
It really is. And it's important to remember that even without speech, individuals with CDD can still learn, grow, and connect with others.
Absolutely. No, I remember reading something about developmental regression in this research paper. Can you explain what that means and how it affects people with CDD?
Developmental regression is a heartbreaking aspect of CDD for some individuals. It basically means that a person loses skills they had previously acquired.
So they can be developing normally, hitting milestones,
Yeah.
and then suddenly start losing those abilities.
Exactly. It's like taking steps forward and then unexpectedly taking steps back.
What kinds of skills might someone with CDD lose?
It can vary. But some examples include losing the ability to walk or stand independently, losing hand-eye coordination, or even losing the ability to communicate using gestures or signs.
Wow, that's really tough to comprehend.
Yeah.
How common is developmental regression in people with CDD?
The research indicates that it affects about half of all individuals with CDD.
So not everyone with CDD experiences regression, but it's definitely a significant concern. This is all so fascinating, but I have to admit it's a lot to take in. How do doctors even keep track of all these different aspects of CDD and how they're changing over time?
Well, there's a tool called the CDKL5 Developmental Score, or CDS, that helps doctors track 7 key developmental milestones in individuals with CDD. These milestones include things like achieving head control, sitting independently, and reaching for objects.
So the CDS gives doctors a way to kind of measure progress, or in some cases, regression.
Precisely. It helps them get a clearer picture of how each individual with CDD is developing and to tailor their care accordingly.
Okay, I'm starting to get a much better understanding of how complex CDD is. We've covered a lot of ground already. The CDKL5 gene, the different types of seizures, intellectual disability, developmental regression. Is there anything else we should know about the challenges that adults with CDD face?
There are a few more things. For instance, about a quarter of adults with CDD experience symptoms that resemble Parkinson's disease.
Wait, Parkinson's? Like the tremors and stiffness?
Yes, similar symptoms. It's a relatively recent observation, and researchers are still working to fully understand the connection between CDD and these Parkinson's-like symptoms.
That's incredible. So CDD might have implications beyond just epilepsy and developmental challenges.
It seems that way, and it's one of the reasons why this research on adults with CDD is so important. It's revealing new facets of the disorder that we didn't fully appreciate before.
Okay, I can't wait to learn more. But I think that's a good place to pause for now. We've covered a lot of important information, but there's still much more to discuss.
You're right. We still need to delve into some of the other findings from this research, like the role of different genetic variants in CDD and the issue of late diagnosis.
So before the break, we were talking about how this research is showing us some really unexpected things about CDD in adults, like that potential link to Parkinson's disease. I'm still trying to wrap my head around that one.
It is a fascinating finding. It highlights just how much we still have to learn about CDD and its long-term effects. About a quarter of the adults in the study showed symptoms that were really similar to Parkinson's disease, things like tremors, muscle stiffness, and difficulty moving.
So this isn't just like a few isolated cases then. That's a pretty significant portion of the people in this study. What do researchers think is going on? Is there like a connection between CD and Parkinson's at the genetic level?
That's a great question, and it's one that scientists are really looking into right now. It's possible that those changes in the CDKL5 gene might disrupt the pathways in the brain that control movement, kind of similar to what happens in Parkinson's disease. Or it could be that CDD makes people more likely to develop those Parkinson's-like symptoms as they get older. We need more research to figure this out, for sure.
This is all so complex. I have to say, this whole discussion about the natural history of CDD is really interesting. It makes me wonder, are there other health issues that are more common in adults with CDD?
Yeah, actually there are. This research talks about some other concerns that are pretty common. For example, gastrointestinal issues are a big one in adults with CDD. Constipation in particular is a major problem for a lot of these individuals and often requires long-term use of laxatives.
Oh, wow. I hadn't even considered that.
And sometimes those digestive problems are so severe that people need feeding tubes to make sure they're getting the nutrition they need. It shows how important it is for people with CDD to get comprehensive medical care. Care that addresses all aspects of their health, not just the neurological stuff.
Yeah, you're right. It's about looking at the whole person, not just focusing on one specific symptom.
Yeah.
Speaking of looking at the whole person, what about sleep? Are there any sleep-related issues that are common in adults with CDD?
Yes, sleep disturbances are definitely common. Some individuals have trouble falling asleep, insomnia, while others have trouble sticking to a regular sleep schedule. These sleep problems can really impact the quality of life for both the person with CDD and their caregivers.
Yeah, I can imagine. A good night's sleep is so important. Are there any other health concerns that came up in this research?
A couple other things worth mentioning are scoliosis and osteoporosis.
Scoliosis. Isn't that curvature of the spine?
That's right. And it's fairly common in people with CDD. Sometimes it can be serious enough to need surgery.
And what about osteoporosis? I know that's a condition that weakens the bones, right?
Exactly. Osteoporosis is actually more common in adults with CDD than we used to think, so it's really important to monitor bone health and do things to prevent it, like making sure people are getting enough calcium and vitamin D.
Wow, so CDD really can affect so many different parts of the body.
Yeah.
It's not just limited to the brain.
You got it. And that brings us back to why it's so important to understand the natural history of this disorder. By knowing the bigger picture of health challenges that people with CDD might deal with as they age, clinicians can be more proactive and provide better care.
Okay, so we've talked about the link to Parkinson's-like symptoms, gastrointestinal problems, sleep disturbances, scoliosis, osteoporosis. Anything else we should know about in terms of long-term health for adults with CDD?
Well, one more thing that's been coming up in research is the possibility of heart abnormalities.
Cardiac abnormalities. You mean like problems with the heart?
Yes. Some studies have found that some adults with CDD have irregular heart rhythms or problems with the structure of their heart. Things like atrioventricular block, atrial flutter, prolonged QT intervals.
So CDD could potentially impact heart health as well?
That's what the research seems to show.
Hmm.
And that means it's important for people with CDD to have thorough heart evaluations, especially as they get older.
This is all really important information. It really shows just how complex and how broad the effects of CDD can be.
I agree. And this just reinforces why research like this is so important. It's helping us to see beyond just the seizures and the developmental delays and get a much better understanding of how CDD impacts a person's whole health and well-being.
This has been such an interesting deep dive so far. I feel like I'm getting a much better understanding of CDB now. But before we go any further, I want to circle back to something you mentioned before about different genetic variants in CDD. Can you explain what those are and why they're important?
Of course. Remember how we talked about the CDKL5 gene being like a blueprint for that protein that's super important for brain development?
Yeah, I remember. The builder needs the right blueprint.
Exactly. Well, in CDD, there are different types of mistakes that can happen in that blueprint, and we call those genetic variants. And the specific variant that a person has can actually influence how severe their CDD is and what kind of symptoms they experience.
So not all CDD is exactly the same then.
Right. It's kind of like different shades or variations within the same disorder. For instance, people with what we call missense variants tend to have better developmental outcomes overall.
Well, that's good news, right?
It can be, but the thing is, individuals with those missense variants might be more likely to experience developmental regression as adults,
Right.
and they might also be more prone to anxiety.
So it's a bit of a trade-off.
In a way, yes. Now, on the flip side, people with non-missense variants tend to have a wider range of symptoms.
do?
Well, it could mean more noticeable physical differences, more severe motor challenges, more frequent gastrointestinal problems, and greater developmental impairments.
Wow, that's a big difference. Why would that be?
Well, it seems like those non-missense variants might impact brain development more significantly, leading to a more complex picture of CDD.
This is all getting pretty complicated. Can we tie this back to why it's so important to understand the natural history of CDD?
Absolutely. When doctors know what type of genetic variant a person has, they can better predict how their CDD might progress. It helps them know what specific challenges might come up, which means they can provide more personalized and proactive care.
That makes sense. It's all about knowing what to expect and being prepared.
Exactly. And this brings us to another really important finding from the research, the issue of late diagnosis.
Late diagnosis. You mean some people don't get diagnosed with CDD until they're adults?
Yeah, unfortunately, that's true. This study found that a lot of people didn't get a CDE diagnosis until they were teenagers or even adults, long after their symptoms started.
How does that happen? Wouldn't it be obvious in childhood that someone has CDD?
You'd think so, but sometimes those early signs are really subtle, or they get mistaken for something else. And back when a lot of these adults were kids, CDD wasn't as well known or understood.
So it sounds like awareness is key here. The more doctors know about CDD, the more likely they are to catch it early.
That's right. And the good news is that awareness is growing. Genetic testing is more available now, too. This means that more kids with developmental delays in epilepsy are being diagnosed earlier.
That's a huge relief for families. Getting a diagnosis early on can make such a difference in terms of getting the right support and interventions.
It really can. An early diagnosis helps families understand what they're dealing with and make informed choices about their loved one's care. And it helps them connect with other families who are going through the same thing.
We have covered so much in this deep dive, from the tiny details of the CDKL5 gene to the big picture of health challenges that adults with CDD can face. I'm feeling a little overwhelmed, but in a good way.
I understand. CDD is a complex disorder, but the more we know about it, the better we can support individuals with CDD and their families.
I totally agree. But before we wrap things up, I'd love to hear what stood out to you most in this research. What really made an impact on you?
That's a good question. I think what struck me most was the resilience and the strength of the individuals with CDD who participated in this study. They've faced so many challenges in their lives, but they continue to learn and grow and engage with the world. It's pretty inspiring.
That's a beautiful way to put it. It's a good reminder that even when things are tough, there's always hope, and there's always the possibility of happiness and fulfillment.
Absolutely. And this research really shows how important it is to create an environment where people with CDD and their families feel supported, understood, and accepted.
Well said. We've come a long way today, but I feel like our deep dive isn't quite finished yet.
You're right. We still need to talk about some key takeaways and what this research means for the future of CDD care and research.
Let's do it. We're back, and I'm still thinking about everything we talked about with CDD. It's really been eye-opening to learn about the natural history of the disorder and how it unfolds over a person's lifetime.
It is fascinating, isn't it? And you know this knowledge of the natural history of CDD is so important for clinicians.
Yeah, absolutely. Earlier you were saying how understanding the typical progression helps doctors make better decisions about treatment and management. Can you maybe give me an example of what that would look like?
Sure. Let's take scoliosis. We know that's common in individuals with CDD. Well, if a doctor knows that they can monitor the patient's spine development from a young age and maybe intervene early with things like therapy or bracing, that kind of proactive approach can sometimes prevent the need for more serious interventions like surgery later on.
Okay, yeah, that makes sense. It's like having a roadmap to guide the clinical care.
Exactly. And that's what makes this research so valuable. It's giving clinicians that framework for being proactive rather than reactive in their care for individuals with CDD.
I'm starting to see how this research could really change the way we think about CDD care.
That's the hope. The more we understand the long-term trajectory of CDD, the better equipped we are to provide care that is more comprehensive and individualized. Care that doesn't just focus on the immediate problems, but also those potential long-term complications.
And hopefully this leads to more effective treatments, too.
Absolutely. Knowing the natural history of a disorder is often the very first step towards developing targeted therapies. The more we learn about how CDD works, the better our chances of designing interventions that actually get to the root of the problem and improve outcomes for individuals with CDD.
It feels like we're getting close to some big breakthroughs.
I think so too. The research is moving so fast,
Hmm.
and with more awareness and earlier diagnosis, we have a lot to be optimistic about.
Well, this has been an incredible deep dive into the world of CDD. I feel like we've learned so much. But it's also clear there's still a lot more to learn.
That's the beauty of science, right? Every answer just leads to more questions. But with more research and with people dedicated to understanding rare disorders like CDD, I think we can really make a difference for individuals and families facing these challenges.
To our listeners, thanks for joining us on this deep dive. We hope you found it helpful. Remember, knowledge is power. The more we understand about CDD, the better we can advocate for and support those who are affected by it.
And remember, you're not alone. There are resources available, there are communities out there ready to support you, and there is hope for the future. Keep learning, keep asking questions, and keep the conversation going.
I love that. That's a great place to end it. Until next time, stay curious and keep diving deep.